The jobs you've had, Maka, those are all the ones that the world of pharmacy throws darts at. You've worked at CVS, you've worked at mail order systems, you've worked with Amazon, and now you work with the state. All of those pieces are usually like you have all the
And
employers
I'm still smiling.
you're still smiling and you're still advocating for pharmacy. Give us a spin on working within those entities and seeing here's the outside perspective of why those entities are bad for healthcare, bad for pharmacy, all these things kind of coming forward. What are the positive things that you could see some of those entities doing if they changed their incentive-based system, or if they changed a few things that would be more fitting for our healthcare community, especially pharmacy community, to be able to participate?
No, I think every single one of those companies bring some positivity, especially when I think about CVS has done for the regulatory landscape. Yes, they still can and should do more, but the presence that they have shows the power that they have. That didn't come overnight. But one thing I learned about Amazon, right, when I joined it was everyone was very worried about Amazon taking over the pharmacy industry. Never once when I was in Amazon was that even brought up. It was never about taking over as much as it was challenging and disrupting the roadblocks that exist in healthcare. To be able to have the money back behind a corporation like that allows you to make mistakes. It allows you to challenge and think differently and do programs and do pilots of things. And then if it fails, pivot really quickly and not disrupt your entire business line. I do applaud a lot of the initiatives that Amazon has done with creating direct to consumer. The problem is it works really well for people who already have access to care, people that already have money. It doesn't solve the inequity problem. Even if they solved the access to rural health areas, would they be willing to help the people in the rural health communities that actually need the help that don't have access? You know, the Department of Health, I think, is trying to do all that they can to regulate and ensure safe access because there's still bad actors in the community. But where I think all of these companies, including Department of Health, and I need to say that this is my own opinion, not my employer. I'm not speaking on behalf of the Department of Health. This is my own opinion, is that we need to work together to figure out where regulations don't make sense anymore. Where are we becoming the roadblock? How do we get past all of those items so that we can solve the bigger root of the problem? Not just bringing healthcare to people, bringing like whole person care.